Progress in the search to find a vaccine and treatments to fight COVID-19. Are we getting any closer to a breakthrough? Hello, I'm Anand Naidu, and this is The Heat. The death toll from COVID-19 in the United States is now over 149,000. We will talk about the crisis in the United States with our panel later in the show. Meanwhile, there has been some good news in the last few days as scientists try to develop a vaccine to beat back the coronavirus. Thousands of people are taking part in late-stage trials at dozens of sites across the United States. Scientists in China, the United Kingdom and other countries are also hard at work. And just last week, the world-renowned scientist, Dr. David Ho, announced progress on antibodies that could result in treating and preventing the deadly virus. Dr. Ho is the founding scientific director of the Aaron Diamond AIDS Research Center, and he's a professor of medicine at Columbia University. I talked with him earlier. Dr. Ho, welcome to the show.
Thank you for having me.
Let's start with your work at Columbia University. You and your team announced a few days ago that you've made some progress in isolating antibodies from COVID-19 patients, which would help with prevention and treatment. Now, could you walk us through what that means and what it means for the long-term future of fighting this virus?
So just briefly, we isolated several hundred antibodies from 5 infected individuals. And from these, we surmised that there were 19 that were quite potent in neutralizing the COVID-19 virus. And of these 19, 9 were particularly powerful in killing the virus. And we believe these antibodies are crucial for both treatment and prevention. For example, early in the course of infection, particularly for a person at higher risk for severe disease or death, such antibodies could be administered to prevent progression of the disease. And likewise, let's say for nursing home residents who are at higher risk of severe disease, these antibodies could be given prophylactically to prevent the occurrence of infection. So we believe these are the major applications. And in the course of working up these antibodies, we found that we indeed had a collection of antibodies directed to multiple sites on the spike of the virus, on the outer aspect of the virus. And this allows us to formulate antibody cocktails that would prevent the virus from escaping from our intervention.
So what does this mean for potential treatments while we wait for a vaccine?
Well, in terms of treatment, these antibodies are very powerful, so very low concentrations are needed in order to inactivate the virus. So we believe they potentially could be very useful drugs, antibody drugs. And as you know, we only have the drug remdesivir to treat this virus at the moment. And obviously, such antibodies could be turned into therapeutics.
So you narrowed down the number of antibodies, as you say, to 19 and then to 9, which were very potent. Now, is it true also that people who were sicker produced more or potent or stronger antibodies?
Yes, that's correct. That's been our observation, that the sicker the patient is, the greater the antibody response. And hence, when we were trying to isolate these so-called monoclonal antibodies, we went for the top 5 cases, and all 5 happened to be severely ill in the ICU. And the reason for that is those individuals probably got exposed to the virus at a higher level and for a longer duration. And so the immune system was hyperstimulated.
So what will it take to produce the antibodies that you've identified, that you've isolated, in much larger quantities? What kind of impact will that have?
Well, these antibodies, so we have isolated these antibodies and we have their genes. Therefore, we could insert these genes into cells or cell lines that will then chronically produce such antibodies. And this would be done typically in fermenters that are from a few hundred to few thousand to tens of thousands of liters in volume, depending on what scale you wish to achieve.
Now, what do you make of testing and tracing in the United States? Should there be more testing for antibodies?
I think we need to do more testing of all sorts in the U.S. Antibodies, knowing the antibody status is helpful to a physician in terms of managing a case. But as you know, we also are short of testing when it comes to diagnosing patients because of the surge in infection nowadays.
Now, Dr. Ho, you are world-renowned for your work in fighting the AIDS virus, and in fact, you were Time Magazine's Man of the Year in 1996. In recognition of your work, how would you compare the fight against AIDS to this fight against the COVID-19 virus?
Well, I would say both are extremely challenging, but and both are pandemics of enormous proportions. But HIV was not readily transmissible, and it did not move with the speed that we are now seeing with this virus. But the HIV research progressed a great deal over a 35-year period, and now we're applying that knowledge to other viruses, and of course including this novel coronavirus. But what is striking for this COVID-19 is how easily it's spreading throughout the different populations in the world. And that has been a huge challenge, and everything we do in science to try to halt the spread had to be sped up enormously in order to keep up with the speed of the virus.
There are two large vaccine trials underway right here in the United States. There are also vaccine trials at a more advanced stage in China as well as the United Kingdom. How hopeful are you about a vaccine and when it would be available?
Yeah, I think the vaccine effort today is unprecedented in scale and in speed. And I would say in general, the leading candidates are progressing well in that they have passed the initial phase 1 safety testing, and they also seem to have induced the right kind of immune responses in the volunteers. So they're proceeding, as you said, to phase 3 trials to demonstrate efficacy or protection. I think the prospects are pretty good, I would say, but we need to keep in mind that these vaccines, some of them involve novel strategies that have never been applied in any previous vaccine. So we have to be very cautious. And also, we don't know whether the immune responses induced by the vaccines would be durable. And in particular, we don't know how they will perform in elderly and those with underlying medical conditions. And as you know, those are the individuals who need the vaccine the most. And so I think the prospects are pretty decent, but we need to be quite cautious.
Right, that durability that you talk about, that's very important, isn't it? Because it will tell us how successful these vaccines are. We know that pharmaceutical companies and researchers and scientists around the world are under enormous pressure to produce a vaccine right now. And I'm wondering, how successful will these vaccines be? I mean, are corners being cut right now?
Well, I think appropriately we need to move fast and to see if any of the vaccines could protect. So it is, I think, in my view, proper to move quickly. But we also need to know that we won't have, say, long-term safety data. That will only come with time. And also, we don't know whether there would be a rare complication, and we won't know that until we have immunized a fairly large population in order to assess rare complications. So we just need to bear these things in mind as we move swiftly with the current vaccine trials, because the world does need urgently a vaccine.
Now, some of your financing comes from the Jack Ma Foundation that's named for the Chinese entrepreneur and businessman. Are you also working with researchers in China?
Well, a number of projects. There are certain collaborations. The project that was just published last week in Nature involves the discovery of these antibodies, but the testing of these antibodies in animals, in hamsters in particular, were done by collaborators at University of Hong Kong.
Now, you've been very critical of the U.S. response to the pandemic, its lack of preparedness, its lack of testing. We're now several months into this pandemic, and why are we seeing such huge numbers in terms of people infected and the number of deaths?
I think it's tragic where the U.S. Currently stands. I think our response is resembling that of a developing country. We have way too many cases and way too many deaths for a strong and rich nation. And we're still unprepared. We're still short of tests. We're still short of a proper public health response. And in many ways, that's because of lack of leadership, lack of political will and commitment to want to fix this situation. You know, the messages from the top down have been very mixed at best. And you know, what is a public health issue has been turned into a political issue. Wearing masks should not be a political statement. It is simply the proper thing to do. So there is some confusion about freedom versus responsibility. I think you know, freedom is a good thing, but freedom comes with certain set of responsibilities, and I think we're ignoring that to a large extent.
So if a course correction had to be made now by the United States, what would you like to see happen?
Well, I think we need to just, you know, particularly in states where the infection is rampant, we need to slow down and curtail the spread by wearing masks, by social distancing, and by good hygiene, and bring this to a low number before we could think about reopening. I think there's a lot of confusion about, you know, the false debate that this is between health and economy. But without good public health, you're not going to have good economic health. And unless you take care of the former, that is public health, you're not going to be able to reopen schools or businesses or societies, simply because people will be fearful, and nothing will return to normal when the infection is widespread.
Looking ahead, what are your biggest fears about COVID-19?
Well, you know, we're still only in the first 6-7 months of this pandemic, and yet the situation, globally speaking, is worse than ever, with many countries now experiencing exponential growth of the pandemic, and it's only likely to get worse. And for the foreseeable future, i.e. rest of this year, no scientific intervention is going to come along and provide the ultimate solution. I think perhaps we have a chance of that for next year. So we really need to buckle down and mitigate against the spread of this virus immediately. And yet that is not happening in way too many places, including the U.S.
Dr. David Ho, thanks for joining us, sir.
My pleasure.
Right, and let's turn now to the situation in the United States, where the number of coronavirus cases has topped 4.3 million. Joining me via Skype is Peter Chen Hong. He is a professor of medicine and an infectious diseases specialist at the University of California, San Francisco. Also with us via Skype from Texas is Benjamin Neuman. He is the head of the biology department at Texas A&M University-Texarkana. And with us from Washington is Joseph Williams. He is senior news editor for U.S. News and World Report. Welcome to all of you to the show. Peter, let me start with you. As we've just been discussing, there are now at least two late phase vaccine trials underway. What is your assessment of the situation?
My assessment mirrors that of what Dr. Hu mentioned, which is that it's much faster than everyone thought. And there's a little bit of variation between the different countries. The sort of West with a more methodical phase 1, phase 2, phase 3 approach. And then there's a Russian approach, which is a little bit more atypical.
You know, Peter, vaccines normally take a long time to develop. They take years. I mean, somebody pointed out, I think the measles vaccine took 8 years. What's changed?
I think what's changed is a variety of things. Sense of urgency, the globalization of everyone's vulnerable, the investment of dollars. So in the US, as you know, there's Operation Warp Speed with literally billions of dollars invested, not only in the vaccine development scientifically, but also the distribution issues that might come up. And then, there's technology. So we've come a long way. There's a more diverse way of producing vaccines from new ways like Dr. Ho had mentioned that hadn't been tried before, as well as some tried and true tested ways.
Right. Are you seeing a lot of international cooperation? Should there be more cooperation between different countries?
I think there should be a lot more. Right now, it's a vaccine race, not unlike an arms race, and I think that's concerning for some reasons. There are a few front runners, and it's almost like Salk versus Saban for the polio vaccine all over again.
There was some news late on Tuesday out of Moscow that Russia might soon approve a vaccine. What do you know about that?
I don't know as much as I would want to know. I think, again, what some people have worried about with the Russian vaccines is, again, safety, because it takes quite a few months to look at some of the early phase development in vaccines, not really as much for efficacy as much for safety. Right. So I think, again, with a mishmash approach, it's promising, but I need to see more data.
Right, they're talking about 2 weeks, actually, approving that and for use in 2 weeks. Benjamin Neuman, the president here in the United States, President Trump, he has been calling for states to reopen, but there's been a federal report which the New York Times got hold of, and that federal report urges 21 states, they call red zone states, to impose more restrictions. And one of those states is where you are right now, Texas. What is the situation there?
Yeah, Texas right now is in a fairly bad situation. We have more cases per day than most nations in the world, certainly more than I think in all of Western Europe put together just here in Texas. And that's not sustainable, and it's not clear what inroads are going to be made in actually cutting that number down.
Joseph Williams, President Trump is back with the coronavirus briefings. He held one just a few hours ago at the White House. But the thing is that his experts are not with him. Dr. Anthony Fauci, Dr. Deborah Birx, they're not with him.
That's correct. It's turned more into a one-man show with the president delivering his message, and that message often does not center solely on the coronavirus and the race for a vaccine. We've had some rumblings that there has been a little bit of a tiff and perhaps a nose out of joint situation between President Trump and Dr. Fauci. He had a tweet storm on Monday suggesting that Dr. Fauci was not as reliable as he should be, and that there were some problems between Dr. Fauci and President Trump as far as veracity and as far as the virus antidotes are concerned. He was promoting hydroxychloroquine again over the weekend and again today. So it seems to be that he's taking these briefings on by himself to try to focus more of the spotlight and perhaps use it as a de facto campaign message.
But Joseph, where is he getting his information from? I mean, he's been citing a doctor with very questionable credentials.
That's exactly right. He retweeted a video snippet of a doctor in Texas, Houston, I believe, who claims that she has a miracle cure and that hydroxychloroquine will not allow, that if you take hydroxychloroquine, you won't have to wear a mask and the virus will cure itself. That's completely unfounded and completely unproven, and so beyond the pale that Twitter took the extraordinary step of taking down that tweet and smacking President Trump on the wrist. He seems to be getting his information from sources that are far from credible, certainly some conspiracy websites, some social media sites that promote more conspiracies about the virus and that promote quack cures that really could do a lot more harm than the president apparently realizes.
Yeah, very unconventional sources, and that's being charitable about it. Benjamin, as we heard Dr. Ho tell us at the first part of the show, this has become very, very politicized, unfortunately, which is not helping the fight against the coronavirus. So what do you see in Texas?
Yes, it is at least as politicized in Texas as it is in the rest of the country, perhaps more so. You have a real divide here between the cities. And the large cities in Texas are in large part enforcing the mask orders, and their numbers are going down rather dramatically. And the country, where mask orders have been flouted right from the beginning and where cases are actually rising. This is the situation we were in as Texas came out of the lockdown, with one part doing well, one part doing badly. And it's not clear how this is going to change. As Dr. Ho suggested, this is a problem that in the short term has to have a social solution. The science is worked out, but getting people to actually follow that science is another kind of problem altogether.
And are you seeing, for instance, as these numbers go down, what role are hospitals and doctors playing in this? I mean, is there enough medical infrastructure to cope with those increased numbers?
There is not, and it's rather difficult to get some of those numbers now. I know about a week ago we changed the way that some of those numbers were reported, with them going directly to Health and Human Services rather than the CDC. The CDC used to have a very nice website that showed you hospital occupancy, and you could break it down by state or even county. That has been taken away in large part. What you get is a 7-day average now, which doesn't tell you very much about what's going on the ground right here. But individual reports out of hospitals show that very many of them are indeed fully stocked in terms of their ICU capacity is full. And this means that those hospitals have to either take away rooms from other kinds of procedures or start little pop-up expansion areas in order to treat new patients. And there will certainly be new patients because the real sickness and the deaths tend to lag a week or two behind the caseloads. And about a week ago, we had a very high caseload of, I believe it was around 14,000 people in a single day.
Peter, what is the situation in California? California at one time seemed to be doing really well, and then the numbers shot up again. What caused that increase?
So there were several factors that caused the second increase in California. The first was, of course, shutdown fatigue. But mainly, I think it was because, we didn't have quite the burden of disease that was in the tri-state area of New York, New Jersey, and Connecticut. So we were victims of our own success, so to speak. We didn't see people walking and falling sick with COVID. We didn't see or have relatives in the hospital with COVID. When I talked to my friends in New York, everyone knew someone. So that, in a sense, was another factor. The third factor was that we had images of people, rightfully so, in protests, George Floyd, structural racism. So the images were that it was okay to go out together with reopening the society. And I guess the second part of the message, which was to do it safely, was not heard as much by the community.
Right, and Peter, how is the state of California now coping with these increased numbers?
Well, I think we're kind of at a plateau almost, but at a higher plateau than we were before when we had our first case increase. And we're hoping that the restrictions that Governor Newsom put in place about 2 weeks ago would have some benefit in us flattening the second curve, although we're higher at the second curve.
Joseph, as you pointed out a moment ago, there's been a sad lack of political leadership at the national level in fighting this coronavirus, but President Trump in the last few days seems to have changed his tone, changed his mind, especially on things like wearing masks. Has that helped in any way? Is the message getting through?
One would argue, judging by the numbers, that it's at least too little too late. I mean, not only had the president grudgingly agreed to wear a mask and grudgingly promoted it as a safety measure to help the virus spread, then the next day he promotes hydroxychloroquine again. The next day he trashes his lead point person on the virus. And the next day he talks about how he really is misunderstood and why he doesn't understand why his ratings aren't better than the doctors. I mean, it's very curious, it's very dangerous, especially when you consider the fact that we as a nation we may have red states and blue states, but we are certainly not static. People from red states travel to blue states. People travel from blue states to red states. The virus comes with them. And so unless we unify and get it all under control, and that won't happen until we have a robust message from the president, I fear we're going to be stuck in this mire in which the cases kind of surge and then relax and then surge and relax. And then the pressure to have the economy open, it's just irrelevant at this point because the economy will not function unless we have a virus that has been quelled and unless the curve has been bent downwards.
Right, Benjamin, as Joseph says, there is pressure to open parts of the economy. There's also pressure for sports to reopen. Baseball and some other sports are reopening, but they're already in trouble. We've seen that teams like the Miami Marlins reporting several positive tests. Does the U.S. really have to reassess this now?
It's kind of inevitable, and I think we're going to see the same thing when schools reopen, and I think we've been seeing some of the same thing from parties and from church services. When you get large groups of people together, this allows the virus to be transmitted, and it doesn't really matter where it is or why you're doing it. And I think this has been a very consistent message coming out of the scientific community. We keep trying to find ways to balance this and say, well, we'll do a little bit of this social distancing, but we still want to have all the other things. And that is not working. Coronavirus does not balance. You try and put it on the scales and it just keeps growing. And that's the situation that we're running into, I think.
Peter, Benjamin mentioned schools and colleges and the reopening of those institutions. What would it take for schools to reopen safely? I mean, what kind of numbers would it have to get down to before we know that it's safe for children to go back?
So there are two measures that have been floated around. One that was mentioned by the Surgeon General, which is that you'd want your test positivity rate to be below 10%. And in that measure, California meets it. But again, there's a lot of regional variation. And there are a bunch of other metrics that one can use. So I think just using one metric may not be quite enough. But I think there is enthusiasm by people to reopen when we can safely, and it may be age dependent. We know that for kids under 10 years old, that they may be less likely to get COVID and less likely to transmit it, based on that, particularly a South Korean study recently published. But it depends on what your circulating virus is in the community. And I don't think anyone would be safe or feel safe for their kids to go out there, given that.
Okay, and that's where we have to leave it. Thank you to all of you for being with us. And that's where we have to leave it. That's a great discussion. I'm Anand Naidu. Thanks for joining me.